HUDE Hour right here on HUDE Network. As always, we are here to break down issues within the humanitarian and development space. We want to shine a light on advocacies. We want to ensure that sustainable development is at the front burner in all cases. As always, I am Amadine Ogbewe. And right here in the studio with me, I have a number of persons right here to help me tackle the issue at hand today. I have my colleague here, Paul Oladipupo. How are you doing, Paul?
Very well, thank you. It's nice to be on board today.
All right, good to have you. Yeah. And also we have in the house our in-house psychologist and also analyst on a number of issues, particularly when it comes to sustainable development. We have Jennifer Kizito. How are you doing, Jennifer?
Good.
Good to have you again.
Thank you.
Welcome back.
Always a pleasure whenever you're around. So anyway, let's talk about the issue at hand today. We're talking about dengue fever. Some people call it dengue fever. It depends on the pronunciation there. But it's about the psychological aspect of this. The issue has already been overflogged as to how to tackle the disease, recent outbreaks, and all of that. But today we really want to take a look at the psychological impact of this consistent outbreaks across the globe. Now, dengue is a mosquito-borne viral infection that causes a severe flu-like illness and can sometimes lead to a deadly complication known as severe dengue. Now, the number of people infected each year has skyrocketed up to 400 million cases annually, with nearly 4 billion people at risk in over 100 endemic countries. While there is no specific cure, management focuses on relieving symptoms and preventing complications like bleeding. The virus can infect a person multiple times in their life, and outbreaks continue to grow, affecting both physical and mental health. In today's episode, we'll discuss the psychological impact of dengue outbreaks, exploring how emotional support can complement medical care. We'll be right back. Don't go anywhere. Now, so our first news item, new research from Taiwan has found that dengue fever is associated with both short and long-term increases in the risk of depression. Drawing on medical records from nearly 50,000 dengue patients, the study adds to growing evidence that the virus can cause lingering illness beyond the immediate infection. Published in PLOS Neglected Tropical Diseases, the study by Dr. Hussein J. Shi and colleagues at National Cheng Kung University analyzed health records from more than 45,000 dengue patients and over 226,000 uninfected individuals between 2002 and 2015. Their findings revealed that those who had dengue were significantly more likely to develop depressive disorders, not only within the first 3 months after infection, but also up to and beyond a year later. The median follow-up time was 3.3 years. While dengue transmitted through mosquito bites often causes only mild or flu-like symptoms, previous studies have pointed to lasting issues such as headaches, skin rashes, and chronic fatigue. The new research highlights concerns that these prolonged symptoms could contribute to enduring mental health challenges, particularly depression. Well, that's a very chilling research there that coincidentally was further publicized by Gavi, the world body that's focused on tackling a lot of health issues. And I think what strikes me, the first of all, is that we're actually here to speak about the psychological impact that is when treating dengue fever on its own, only to now find out that the very disease we're talking about even potentially has tendencies of actually directly affecting mental health, and not just as a result of how it's being treated and how healthcare workers are dealing with it. So what do you think about this study, Jennifer?
It's sad, but You see, one of the things about illnesses is that beyond having the physical symptoms, it does something to your mind when you experience certain illnesses. So, and the thing with dengue fever is the fact that it doesn't have a cure yet. This increases the chances of having psychological effects, side effects, because you are not sure of what's going to happen. And you are moving from progressive stages. You're only praying you don't get to the most severe stage, which could lead to death. And now we're talking about some symptoms that come with dengue fever, like rashes, fever, headaches. Imagine living up to like 3 years and still carrying the symptoms of dengue fever.
Yeah.
And you can't really, it's not like maybe you are not cured or maybe you're not okay, but it's just that the symptoms, they persist. They stay for a long period of time. Living with such prolonged symptoms can only make you feel inferior, make you not be able to get back into mingling into the environment, coming in contact with other people. And also, we're talking about the fact that dengue fever also has other psychological factors that are involved. Take, for example, knowing that you would be able, like, you can get dengue fever again. It's not like measles or
Yes.
chicken pox. So there are chances that after I have dengue fever right now, in the next 3 or 4 months, there could be a reoccurrence if there is a sudden outbreak again. So it's not like you are getting off it entirely. So it's not like measles and chickenpox where you say where the chances of getting it again it's less. So these are all the things that happen or you could find with dengue fever.
All right. What do you think about
Well,
it?
so I would start by defining what health is. Health is basically a state where your physical, your mental, and also your social well-being is all intact without any, without absence of disease and things like that. All of that. And it's interesting that so for a disease like this, dengue fever, yeah, where there's no cure per se to it, it box you in a place where, and imagine living for it. I mean, having rashes now and then, having very high fever, all of those things, fatigue, not able to do things, normal things that you would do. I mean, there was a time when I wasn't feeling fine, and then I had just malaria, funny enough, and the drug I was using felt like it was making the malaria all worse. And at the point, I was like, if this is what malaria is, like, I should just you do understand? I was not just ready to endure all of those pains and all of that. So imagine living through all of these pains months after facing the real heat, and then it goes down a bit, and then you are still living with rashes. So for people who are very sensitive, they don't have, like you said, there's this withdrawal from the environment, from society, and all. And it just tells us that it's not just about being unwell. Basically, it's not just about the physical state; it also has the mental implications. Because while being sick here, there are a lot of things that goes on in your head while lying on the sick bed.
Indeed, and I think you've really broken it down. To use maybe my personal experience, I've not had dengue fever. I don't know if I have. Sometimes, you get a wave of sickness, and sometimes you don't get so a diagnosis, and it just goes away. But I think part of the things that happens for me personally, is that I get sick very rarely. And the moments it does occur, I can forget what it feels like. But when I'm in that moment, and I think this is what everybody relates to, which is that you just want to be well again. You forget
Like
what
at
it
that
was
instant,
like
exactly.
to have an appetite. So, I mean, there are times when I've been sick and I saw my favorite food and I said, I will come back for you when I'm ready,
Right.
stuff like that.
Yes.
So I think that's another psychological aspect. Then there are people who get sick almost regularly. And I think that's something that can also lead to some of these issues. But away from that, we are even saying now that the disease itself now is potentially even causing that was directly linked to mental health issues. And I wonder, or what I think, sometimes silver lining, sometimes we look at what might be the best out of this is that maybe we might start to see some seriousness from everyone as to how the disease is being treated, or people who have it, to say that, okay, it's just the disease with less than under 0 point something percent fatality rate, almost everyone survives it. So why should we bother about mental health? But now that you know that there are potential long-term effects, maybe we start to see a global push to ensure that this aspect of the disease, or we ensure that mental health coverage or assistance or process is added to this issue to resolve it.
But again, I also would like to draw attention to we as a society as well. If you know that someone had dengue fever at a point in time, it's also important for you to go ask them, okay, how are you doing now? It's not just about it's not just about you, just seeing the person all well, right? Also care for their mental health, and also for doctors as well. Recommend them to go see a psychiatrist, a psychologist, yes, so that it doesn't get to a very chronic stage. Because I know that even depression has stages and all of that.
Indeed, indeed. So we'll go on a quick break now. When we return, we'll delve into our second news item for the day. Don't go anywhere. We'll be right back. Welcome back. And now we'll delve into our second news item of the day. This is as regards the outbreak update. Dengue cases are on the rise across the Americas, with more than 13 million infections reported in North, Central, and South America and the Caribbean in 2024. Health officials say transmission remains high in 2025, raising concerns not just for local populations, but also for travelers who are bringing cases back to other regions. In the United States, Puerto Rico, and the US Virgin Islands declared dengue outbreaks in 2024, with Puerto Rico extending its outbreak declaration through December 2025. Local transmission was also reported last year in California, Florida, and Texas, and Florida continues to report cases this year. Dengue, the world's most common mosquito-borne disease, is caused by 4 closely related viruses and spreads through bites from infected Aedes mosquitoes. Public health authorities are urging the public to take precautions and prevent mosquito bites as the outbreak intensifies. Well, again, you mentioned something already, referencing what you said about how it's a disease that you can get more than once. How do you think we can begin to ensure that the mental health aspect is taken care of while handling these diseases?
I believe that the government leaders, they should create a system for people to interact with psychologists or mental health care workers. They should incorporate it into the system for people who have dengue fever. Now, we've seen that there is a direct link between the fever and mental health issues. So now, since we've established this relationship, then we should see how we can get the government, get systems to now begin to involve healthcare workers, mental health care workers into the system, so that they can provide mental health support, emotional support, let people air their fears, let us know what people fear, because more than what we go through, sometimes our mind, it's mind over body most of the times.
Yeah.
If our mind is sound, then most of the times we can conquer whatever it is that comes our way. So if we have the right frame of mind, it does not worsen the sickness. It does not worsen where we are. Having the wrong mindset, feeling depressed, hopeless in the whole situation can only worsen the sickness. It can only put you in a place where you might not actually respond to the treatment, then managing the illness in itself. So we must now incorporate healthcare workers, mental health care workers into the system. If people are diagnosed of dengue fever, they should have an opportunity to talk with someone so that the person not just understands that there are physical ways to treat this, but there are also mental ways that there's a posture you should take mentally. Because we now know that since the cure is not here, there are symptoms that could prolong as far as 3 years. So if we are aware of this, that means we must prepare people's mind for the outcomes. So, but when people just face it without the preparation, without the guidance, then they eventually will fall into a depressive state.
Fair enough.
Okay, so in preventing mosquito bites, it sounds like something that's almost impossible because you have to go out one way or the other. It's not every time you'll be on long clothes to prevent them from. But again, even exposed areas itself are still there, right? But I think I would love to come from an angle of environmental sanitation because this mosquito breed where there are stagnant water, places where there are deaths around. So if your environment first is clean, they have no breathing space, and so they are away from the environment, first off. Another one again is to ensure that your vicinity, your residence, right, is probably your house has nets and things like that. And now we even have mosquito nets. So if you're in an area where there are so much of mosquitoes around, it's advisable that you get a mosquito net just so that you prevent yourself from having all of these diseases. And just with that, poco a poco, we're trying to get all of these guys away from my environment, and that's the main thing that we're talking about here. It's not just about looking for what to do after getting the virus, right? But also what can be done even before the virus comes. Try to get insecticide to ensure that you can always fumigate your surroundings regularly. If you know they're in an environment that there are actually plenty, or places where there are actually outbreaks as well. And all of these things, and we'll see that we are able to prevent these mosquito bites in a real sense.
Indeed, indeed. Sometimes you go after the cause to increase your chances of being healthy. I mean, we have environmentalists who say that the money you refuse to spend on sanitation, you're probably going to spend it in the hospital.
And you spend more in the hospital.
Indeed, indeed. So that's our round off this segment of the program. We'll go on a break. When we return, we'll delve into verified voices. Don't go anywhere. Every day, amazing stories of hope and tenacity unfold across the globe. On HUDE Hour, we dive into these inspiring tales and discuss the vital work being done in the humanitarian and development space. Humanity has never faced a shortage of challenges, yet we rise stronger through teamwork and determination. Though these remedies are often underreported, on HUDE Hour, we advocate sustainable solutions. We bring you the latest and most impactful news on how lives are being changed. We engage with young change makers and experts who provide valuable insights into relief efforts and the challenges faced by local communities through a global perspective. Join us every Wednesday by 8 a.m. on HUDE Network's YouTube channel as we embark on this journey of positive change.
Hey everyone, let's face it, our world today experiences numerous challenges. And guess what? Our community isn't off the hook either. Most of the world issues are either not talked about enough or never talked about at all. But here on Timeline, we've got you covered. We dive deep into issues that affect us every day, leaving behind footprints of wisdom, knowledge, and solutions. Think of it like a roadmap that keeps you on the track for success. So buckle up, because in this new season of Timeline, we're taking another trip through the past, the present, and navigate into a more promising future. Again, we're talking solutions, people, and let's make one thing clear. This is not your average blah, blah, blah convo. This is real talk with a side of inspiration and a sprinkle of wow. I never thought about it like that. I'm your host on this impactful ride. Together, we'll tackle the tough stuff, laugh a little, and find ourselves on the path to positive change. So what are you waiting for? Season 2 of Timeline will be loaded. Let's get started. Hop in, and let's drive straight into the heart of issues shaping our world. Let's go. Oh, one more thing. Hit that subscribe button and let's take this ride together.
We're delving into verified voices on the issue of dengue outbreaks and the psychological impacts they have on communities. Paul, let's hear what you have for us today.
Hey, you're welcome to Verified Voices. Let's see what our Verified Voices are saying in this segment. First off, on our tweets from today from the Danish Red Cross there in Nepal, they are saying that climate-sensitive diseases like dengue are on the increase, with Nepal experiencing surging caseloads in the aftermath of recent extreme weather events. Dengue impacts people's physical health, but it can also affect their hashtag psychological well-being too. And I think this is actually pointing out to the fact that dengue isn't just coming for your physical health, it's also coming for your mental health. It's sometimes after the physical health, after dealing with the physical health, it leaves that one alone and then goes to the mental health. And that is what this particular tweet is pointing out. It's also important to note that with all of this rising heat wave and things like that, breeding of mosquito now is easier. We're seeing them more. They are basically in living that for them. We are experiencing heat wave, but for them it's more like a more favorable condition, and that's what this tweet is pointing out. That it's important for us to know that all of these things can also be linked a bit as well to climate change. But regardless, dengue fever doesn't just attack the physical health, but also the psychological health of the patients.
Indeed. I feel we need to hear more before we start dropping our comments on the verified.
Exactly. Let's move on quickly to our next tweet from Welcome Trust there. I think most of our tweets today are going to be on climate change. But let's take a look at what Welcome Trust is saying right there. They are saying that flood have a huge impact on people's health that lasts far beyond the event itself, from the spread of diseases like cholera and dengue to mental health effects and disruption to ongoing healthcare. We can find more about this on these tweets. But let's take the next tweet quickly. Also, still talking about climate change and what it has to do. This is from Olukunle Omotosho. It says, climate change is a health crisis. Worsening air equals more respiratory issues. Warmer temperature equals spread of malaria and dengue fever. Food and water insecurity equals malnutrition. Heat waves equals death. Displacement equals mental health. To act now protects people and the planet. Hashtag climate health, hashtag public health, hashtag SBC. The link between climate change and emerging health crisis. It just makes more sense now. I'm seeing the fact that with all of these things that we're having, we're seeing mosquitoes breed more. And also flood again, we're talking about stagnant water. Flood is going to be, if there's flood in an environment, the water is going to be stagnant for a while. And it's coming from probably a stagnant place as well. So it's moving all of these guys with them as the flood is moving. And that's what we're seeing here. And I think Olukunle there broke it down in so many pieces, talking about what exactly and how climate directly impacts the health. And it's very interesting to see that climate change actually has a very huge impact when it comes to our health.
Indeed. And even heat waves generally, being in places where your temperatures are already high can put you in a mood, so to speak. And then having the added effect that the vectors of these diseases are thriving and then infecting you, having all these complicated issues. And that's why it's important where we saw the tweet from Red Cross. These are people who are usually involved in first responders and trying to help with issues, outbreaks and the likes. When too many
I think it's also
sick.
important that I note that they were also able to sweep into action by trying to sensitize the public, because we know we're in a time of misinformation and all of that, and they were able to address that. And those who needed psychological help also, they were able to provide that particular help and also try to decrease the anxiety, because in fact it's funny that already there's the effect of dengue already, and then what is even more funny is that some people are even facing the heat without even having the fever yet. Talking about anxiety.
All right. What do you think about that, Jennifer?
Well, it's Olukunle already made it very clear, because we see that climate change leads to so many things that then eventually affects mental health.
Yes.
So if we've come to the point where we've established this relationship, then we must take mental health care very seriously.
Exactly.
Because most things that impact our body eventually impact our mind. Most things that impact our environment eventually impact our mind. So at the end of the day, we should focus also on our mental health, not just treating the physical outcomes of the things that happen to us, but we should provide accurate mental health care services across boards in order to actually begin to tackle the mental health issues that could come out of all these situations or all this climate change after effects.
Indeed.
Okay, now let's take our final tweet. This is from a photographer there, and he's literally explaining to us how dengue actually ruined his own Christmas. So let's take a look at this tweet quickly. It says, this is from Danny Portman. It says, travel back to Netherlands to visit family for Christmas. Instead, got dengue the day we landed. 40 degrees fever, 160 heart rates. Called the ambulance because it hit me so suddenly. He called in to bring me into the hospital, but was told I wasn't sick enough, so they won't accept me. So back to my room it was. Finally got an appointment as my mother's doctor, who at least was friendly enough to see me. Told there was nothing I could do and just had to seek it out. Worst 10 days of my life, sick at home in bed, no medication, just sweating it out, horrible symptoms, couldn't eat, couldn't hold liquid. Glad to be back to Bali soon, where I can at least get a bit more help when something like this happens. I think this particular guy's story is very, very interesting because it's a number of things. Because now he's talking about how he even went to the hospital, but unfortunately they couldn't. He didn't look sick enough for them to admit him, and that means that already they have probably shortage of bed space in the clinic where he went to, and it's also he just had to at the end of the day just stay at home and seek it out. Now we're talking about the psychological impact here. Yeah. I remember
for
being
10 days.
Exactly, for 10 days straight, not even seeing the light, basically. And it just reminded me of one Christmas where I was very, very sick, and I'm someone that I love Christmas food so much. And on this particular day, when they brought the food to me, it felt like so much work to do. And I looked at that food for almost 4 hours before I could finish that particular food. And this is just the same experience that this photographer had. And it's for him, it's even more sad because there were no medications to take. It was just on the bed there, couldn't eat, couldn't hold liquid. And he just had to seek it out, just like he said. Just hope for one day I get better and I'm up on my feet again.
Indeed, and I think it's sort of an indictment on some of the health systems where, due to shortages, anything short of an emergency or perhaps a serious emergency is not going to get attention. So that's one aspect of the mental, psychological aspect we're talking about here. First of all, a person is in discomfort and perhaps in pain, and their pain in the first place is not being treated as priority. Now, on the flip side, going through all of that, is that not supposed to have an effect on someone?
It would.
It would. So when
in fact, it actually has already.
Indeed, exactly. And the thing now is that if such a person doesn't get, at the very least, post-dengue help, mental health help, it could lead to more. I mean, the way he's already speaking and all of that about his experience. So anyone who goes through that would need a little bit of support, a little bit of a nudge to let them know that, well, you might have gone through all of this, but there's still good things working out and all of that. People need that mental push after encountering stuff that happened physically and really had a toll on their lives. I wonder what you think about that.
You've said everything. So I'm very sorry to the photographer and his experience. It's not a very nice thing, especially during the Christmas period, like Paul said.
Yeah. Another aspect to that, actually, the Christmas period is about coming together,
exactly.
Celebration. So, but being put in a place where you have to be alone and isolated, you're not eating, you're not drinking. The worst part of it is that there is no specific medication to deal with the illness. You have to, like he said, seek it out. The seek it out is not just about being sick for 10 days. Yes. It's about the fact that you have to deal with, you're thinking about the fact that there is no cure to this thing. So there are many things that could happen. It could actually lead to things that are more serious, like the dengue can get to a very severe stage where you eventually die. But you're actually thinking a lot of things, but at the same time managing the illness. So with all that, imagine when you're now done with the 10 days period per se, and then you now have to deal with the extra symptoms that come with
That come
dengue,
afterwards.
that come afterwards, the rashes, the headache, and the rest of them. Obviously, you won't be in a very good place. In fact, if I was the one, nothing would take me to that country again. I would stay somewhere else.
Funny enough, like I read through the tweets and I saw some of his comments where he was even saying that he was boasting to his wife that back at home we have better healthcare system and all of that. And then this now happened to him, and then she was now reminding him how he has always been boasting of the healthcare system. But it does boil down to the fact that we'll have to, like, we'll try to build our healthcare system in such a way that we're able to accommodate whatever is coming for us. I think that's all we'll be able to take on Verified Voices today. It's been a lovely segment. Try to ensure that you prevent mosquito bites in every best way that you can. My name remains Paul. Thanks for joining.
Thank you so much, Paul. Jennifer, also thank you for joining us today and doing this with us. Well, that's how we'll end the program for today. Let's ensure to take note that there's almost always a psychological or mental aspect to what people go through when outbreaks occur, even issues of stigma and other issues that we can resolve by having a holistic approach to solving this, so that at the end of the day, a person is fine physically and mentally. Let's keep the advocacy up. I'll see you next time on HUDE Hour right here on Wednesday by 8 a.m. I remain Amadino Berry. Bye for now.